Hello, this is Dr. Paul Susic, PhD, licensed psychologist. To my left is William Kuntz, also a psychologist. And we're happy to have you joining us in the maiden voyage of the ShrinkDoc Podcast. I'm going to have Bill kind of introduce himself and talk a little bit about his background. Bill?
Okay. Yeah. My name's Bill Kuntz, and I've been doing therapy for close to 40 years now. Hard to realize, but we do. Time goes by quicker than we expect. My specialties are marriage counseling and individual work with people who are depressed or anxious. Kind of a generalist in my approach, but tend to use cognitive behavioral therapy much of the time. Although in my experience, adjusting therapy to the needs of each individual client is typically what's needed. I'm married, have two daughters, one in San Diego and one in Scotland. So I don't get to see them as often as I'd like. I also have two granddaughters. What about you, Paul?
Yeah, I'm Paul Susic. I have a master's degree in professional psychology from Lindenwood University and also a PhD in professional psychology from Walden University in Minneapolis, Minnesota. I spent about 10 years working in a hospital in St. Louis, went through my internship and residency, and have been in private practice in nursing homes for, I guess, probably about 26 years. The goal and objectives of the ShrinkDoc podcast is for us to talk about many different subjects from a really experiential perspective. Bill and I have both been in the business for a very, very long time, maybe longer than either one of us want to admit. But anyway, but we've been at it for a long time, and I think we have a lot of insight into having worked with probably between the two of us, possibly thousands and thousands of people. Today's topic, I think, is a very interesting topic. We're going to talk about trauma, and we're going to talk about how trauma can affect you, and talk about what you can do to recover from that. Bill's wife went through a very traumatic experience several years ago, and he's going to talk about that and really pretty much about how it affected not only his wife, but how it affected him. So, would you like to tell us a little bit about your experience, Bill?
Sure. I probably should add that I did get my training at the University of Central Missouri, and I've worked at mental health centers as well as private practice in my career. About almost, I guess, 10 years ago now, my wife, who wrote a book around that time, had taken it to a publisher to have it looked at and had the cover proofed. And she was walking out of that office in Southwest City, St. Louis Hills area, very nice part of town, walking to her car. And when she got to the car, she felt something hard in the small of her back and a voice saying, "Get in the car or I'm going to shoot you." At first, I think she said, "Am I being punked?" Because she thought it was a joke. And the person said, "No, this is no joke. Get in or I'm going to shoot you." So she had heard that it was not a good thing to get in a car in that situation, but there were three guys and she had no escape route. So she got in the car. They bound her with duct tape, her wrists, her ankles, put some across her mouth, and had her go into the trunk. Although fortunately it was a Prius, so it was a hatchback. But at one point she said, "I can't breathe," and I think they pulled the duct tape off of her mouth. Of course, all this I'm hearing secondhand. I wasn't there, but wished I had been. Not that I would have been able to do much, but I think what happened then is they drove to a jewelry store. They mainly just wanted her car, it seems like, maybe a hostage in case they needed one. But they took her to this jewelry store, parked the car, and one guy was in navy dungarees, and he went up to the door and rang the bell, and they buzzed him in. Then he pulled a pistol out of his pocket, pointed it at the jewelers, and said, "Okay, buzz my buddy in." They buzzed the second one in. The third one then stood at the door. Now, this is 11:30 in the morning.
Wow.
Broad daylight.
Wow.
But he stands there with an AK-47 keeping guard.
At the front door?
At the front door.
Oh, my gosh.
And
Wow.
the owner or manager, I'm not sure if he was actually the owner, but he was the manager of the store, had a closed circuit TV camera back in the back. He saw what was going on, went out the back door, walks around with his little pistol, takes a takes a bead on the guy with the AK-47 and shot him.
Wow.
And went through his hand, ricocheted off the barrel of his gun. And he freaked out and he yelled, "They're all over the place," thinking there was a bunch of policemen, I guess.
Mm-hmm.
They jumped back in the car and took off with my wife in the hatchback trunk.
Wow.
The man with the gun, the manager did not know that my wife was there, took a bead at the car, was ready to pull the trigger, but as the car pulled out into traffic, he decided it wasn't a safe shot.
Wow.
Had he pulled the trigger,
Thank
odds
goodness.
are he
My
would have
gosh.
hit my wife,
Wow.
since she was the closest to the gun.
What a horrible
So,
experience. My gosh, Bill.
yeah, and my wife said she was thinking, "Oh, I'll never see my granddaughter again," who had just
Wow.
been born about a year before that.
Yeah.
And anyway, they drove to a nearby park and actually pulled into a alley at that point and left her in the car, bound up in the trunk still, or the hatchback. And they said as they left, "Tell the police we were nice to you."
Oh my gosh. Yeah, that sounds
I guess
pretty
they
nice.
could
I
have
mean,
been meaner, but
yeah,
they weren't
yeah.
particularly nice.
Yeah, they could have been just a little bit meaner, yes.
So anyway, she managed to get up
Oh my
over the back
gosh.
seat, crawl up into the front seat where her cell phone was, and call me. And I was in a marriage session at the time. First, I saw that she was calling. I don't usually answer in a session, but then she called a second time. So I thought, well, it must be important. Answered the call, and she goes, "I've just been mugged." And I go, "What?" And she said, I've been mugged, and I think I'm just down the alley from our house.
Mhm.
And the alleys in our neighborhood look a lot alike, and she was about 2 alleys over. But she didn't know that. So I asked the man of the couple that I was with if he would go with me and try to find her. We started running down alleys and didn't find her. On the phone, at first I said, "Hang up and call 911." But the sound of my voice was so comforting to her, she wouldn't do that. So she continued to talk to me. We kept looking. And a neighbor of where she was apparently walked by and saw her in there struggling and called the police. So by the time we were maybe halfway there looking around, she goes, "The police are here." And she directed us to where she was. But that's basically what happened. And she did have some PTSD after that. She's a strong
No
woman.
kidding. My
And
gosh.
and handled it better than I think most people would have. This was
Wow.
around Christmas. They actually said they were stealing jewelry for their girlfriends.
Mhm.
And this was like actually 2 days before Christmas. My wife is a music director at a church, and the next evening was, I guess, New Year's Eve, and she played for that service,
Wow.
which was pretty amazing, I
It
think.
is pretty amazing.
Yeah. But, as far as her recovery, I can talk about that some. I don't know
Yeah.
if you have questions.
Yeah, it's sorry, I just drank something. It didn't go down the right place. But anyway, so overall, uh did you notice, I mean, it seems like she adjusted to it really well for, I mean, something that traumatic, because I
Yeah.
can only imagine what was going through her mind. I mean, my gosh, I mean,
Yeah.
as you said, thinking about, well, is this the end?
Right.
I mean, what would somebody think that's in the trunk of a car?
Sure. Well,
And
actually, her cousin is a police officer and has done training for the FBI. And she talked to him about it maybe a
Mhm.
week or two later. And he said, "You're lucky to be alive."
Oh, absolutely.
In
My
most
gosh.
cases,
Oh, yeah.
it doesn't end well. They
Oh,
get rid
yeah.
of the witness
Oh, yeah.
because she had seen their faces
Oh, yeah.
and actually did identify 2 of them, one of which had blood in the back seat. So they had a positive ID from his DNA.
Was
And
that the one that was shot?
Yeah. And he got 17 years in prison.
What about the other guys?
They got away. The one of them that she identified was arrested and held in jail 2 or 3 weeks. And then he passed a lie detector test and said, told that he was a twin brother.
Mhm.
So based on those outcomes, they couldn't keep him.
Yeah.
But likely he was just good at
Mhm.
faking a lie detector test.
Yeah.
But anyway, only the one of the 3 got prison time, and he wouldn't rat on his friends. But as far as her recovery, several things helped. First of all, just me reassuring her. I remember saying
Mhm.
over and over, "You're safe now. I'm with you. They're not going to come back."
Mhm.
But she wanted cameras put around our house,
Yeah.
the locks changed. We did
Oh,
all
yeah.
that. And eventually we moved out of the city to Kirkwood just
Mhm.
because, primarily, I mean, we wanted to anyway, but primarily because she didn't feel safe in the city, even though we lived in a pretty good
Mhm.
area. But part of her recovery involved psychotherapy. She did about 5 or 6 sessions, which is
Mhm.
all. Probably could have done more.
Mhm.
But the other thing she did was she talked to practically every friend, almost every
Mhm.
acquaintance, and told her story over and over.
Yeah.
And that was healing for her.
Yeah, I bet it was, and it's interesting. I know you told me in the past, you said, she actually handled it better than you did.
Yeah. Well, and the other
And I can
side,
imagine, I mean, with what you're thinking. I mean, we as men, I think we have a tendency to want to, take care of the people that we feel some responsibility toward, and sometimes I guess we recognize that we really don't have
Mhm.
the ability to control things anywhere near as much as we would want to give
Right.
us that sense of security.
Yeah. And as I tell a lot of my clients, control is really mainly an illusion.
Oh, it is. It
We
is.
want to
Absolutely.
believe we're in
Absolutely.
control, but push comes to shove. There's very little
Really?
other than our own
Really?
reactions that we
Yeah,
can control.
absolutely.
And even
Absolutely.
those we can't control fully.
Right.
But let me talk about my reaction some.
Okay.
I did have secondary trauma,
Mhm.
having heard her story. And the other thing that was surprising to me was guilt. I felt a tremendous amount of guilt
Mhm.
because I had not protected her from that.
See, that's what I'm
Yeah.
talking about.
And I knew it was irrational
Mhm.
because
Right, right,
no
right,
way
right,
I could have
right.
known that was
What
going
can
to
you do?
happen. Or if
What
I'd
could you
been
do?
there, I probably would have just gotten shot.
Probably.
So if I tried to confront them. So I realized logically there's no reason for me to
Mhm.
feel guilty,
Right,
but that
right.
didn't make the guilt go away.
Yeah.
So I struggled with guilt. I was
Mhm.
depressed for a while.
Mhm.
I didn't function well and had some secondary trauma, but
Wow.
helping her feel safe, caring for her helped me as well.
That sounds great. So, some of the things that, I mean, it's one thing to hear about these things and seeing them on TV and everything, but actually to experience it and to recognize that with PTSD, I mean, PTSD is such an interesting type of disorder because it not only affects not only your mind and the way you think about things, as you said, your sense of security, her sense of security, putting lights and things like that in the house, it totally destroyed her sense of security in a lot
Right.
of ways.
Yep.
But not only is it the psychology, but it's also the way that it affects our bodies. And I had a
Mhm.
lady years ago that experienced a traumatic accident on the highway, and she basically would not get on a highway anymore. She would have panic attacks.
Mhm.
And so that's the interesting thing about PTSD is that mind and body connection is that it actually affects the body in a
Right.
tremendous way. And so you have these things that might remind you of it. And all of a sudden, not only do you have fear or anxiety, but just a tremendous physiological reaction to
You
this
can
thinking process.
have flashbacks to what happened, and even though you know it's not the same thing,
Hmm.
the feelings come and talk about the body. As
Hmm.
you know, the amygdala, which is like this activating system when there's a problem that
Right, right, right.
tells you to be careful, watch out.
Hmm.
Once that gets overstimulated, you can't just turn it off.
Oh, absolutely.
And similar situations or feelings
Hmm.
can trigger that
Yeah.
so that people can become very traumatized. I
Oh,
had a
absolutely.
had a client once who had been, it's a horrible story, but she had been abused by her own father
Mhm,
sexually
mhm,
for years. And the first time she came to me, I opened the door to the waiting room and she jumped about a foot into the air because
mhm.
she had that kind of hypervigilance.
Hyperarousal.
And so over time, she got better,
Right.
telling her story and working through the trauma. But it was a long road for recovery for her because she had many, many years of severe abuse.
What are some of the things that you could think of as far as some of the core symptoms that you think are associated or you experienced personally that were associated with your experience and maybe just in general for other people if we're trying to help other people understand
Mhm.
PTSD and kind of like what it looks like?
Yeah, well, being able to identify it's the first step. And
Sure.
I already mentioned the hyperarousal,
Mhm.
which is that heightened reactivity
Mhm.
where little things that wouldn't normally set you off can create a big reaction, a fearful, startled reaction. And then, of course, the way it affects our thinking and our mood. I
Mhm.
mean, even with me and my secondary trauma, I had the thoughts of I should have been there, I should have
Yeah,
protected her.
sure,
And when
sure.
those thoughts go through your mind, you can't really control the emotional
Right,
impact.
right, right, right.
So our thinking and our mood, and then of course what she did to some extent was avoid places and people that would
Right,
remind
right,
her of what
right.
happened.
Absolutely. Did that have something to do with your moving from the city? I know you said you had thought
Mhm.
about it anyway, but I guess that
Right.
kinda
That was a big,
speeded up the
to be
the
honest, it was a big factor.
decision-making
I
yeah.
probably sold my house at not the best time in the
Yeah,
market just to get out
probably,
of
but
there.
time to go.
Right. But yeah, I mean, what do you know about the PTSD that
Well,
I didn't mention?
as you mentioned, the, intrusive memories, avoidance, all those things change the mood. I
Mhm,
think it's interesting to understand that PTSD comes in a lot of forms.
mhm.
It could be related to military. I think we've all heard the stories of the Vietnam veterans,
Yeah,
and I actually had one years ago that, that experienced some really, really difficult, traumatic events during the Vietnam War, and he was a young man,
mhm,
19 years old, over there fighting in
mm,
Vietnam. And, unfortunately, he came from a background of a very abusive father,
mhm.
and so he had also the abusive,
From childhood.
trauma that
Mhm.
in conjunction with then going into a
Yeah.
war situation, so I think it could, appear in many different forms. You mentioned
Mhm,
that that lady, that, was hyper aroused,
mhm.
that she experienced, sexual, trauma,
Right.
and so I think it's important to understand that anything that affects us in a very, very traumatic way
Mhm,
and causes us to affect us to the degree that our body is hyper aroused and reacts
mhm.
to triggers and things like
Right.
that. That it could just be a very difficult thing to resolve because of the fact that once again you're dealing with both the mind and the body.
Yeah, and I think what's interesting is two people can go through the exact same thing, and because of their psychological makeup, one person may develop PTSD and the other
Yeah,
not.
isn't that amazing?
Yeah, I mean, there's some people who just have this strong constitution. I don't know why. Maybe it's genetic in part, but they'll be exposed to a horrific
Oh
situation
yeah,
and
yeah.
come through it rather unscathed.
Isn't that amazing? I've seen a
Mhm,
lot of that over the years and have known many people personally who, as
mhm,
you said, have been through horrible experiences,
mhm.
and they've done really well. Some of them being very successful in their life, and other people, I mean,
Right.
relative to some of the things other people experience, it's not that much, and they're ready to commit
Mhm.
suicide or whatever.
Right.
And but the level of resilience among people is just an amazing thing. So
Right.
so there is treatment available then there isn't there?
Sure. There's
And
all kinds of possible things you can get. I mean, you mentioned, just to go back a little bit, military combat. I
mhm,
had an uncle that I'm not sure what he went through. I guess it was in the Korean War, but he came back just so scarred he could never really function again.
mhm. Yeah.
And it's sad.
Oh, yeah.
PTSD is a very real thing. And until World War II, they didn't even know what it was.
Wow.
That's when they first came up with that title, post
Mhm.
traumatic stress
Yeah,
syndrome.
yeah.
Um, but it's real, and it affects us, like you said, not just emotionally, but physically, mentally, and all kinds of areas of life. I might just mention too, talking about military combat. There's also studies that have been done. Excuse me. I used to do some work with schools and school counselors related to school violence, and what some of these studies found is that students who were exposed to any form of violence, even bullying, they'd have a recovery time after that. Not just the ones who were bullied,
Mhm.
but people who observed it. It
Yeah,
would take really 4 days, kind
yeah.
of minimum, before they would get back to a
Mhm,
mental state where their brain would recover to the point it could learn at
mhm,
an optimal level again.
mhm,
So, it's powerful.
mhm,
Trauma, uh, any viewing of trauma, whether it's primary or secondary, takes a toll.
mhm. So some of the things that I guess we need to focus on then is as uh, as we talked about reconnecting with the body somehow and recognizing
Mhm.
ways that we could resolve, maybe relax better and build a better sense of safety Anything else that you can think of that would help to
Sure.
work through this process, and maybe things that you've already
Mhm.
alluded to or some other
Yeah,
ideas?
well, one thing that we're discovering more and more is part of the Eastern philosophy of meditation and
Mhm.
relaxation,
Yeah.
yoga. Those things can be very
Oh,
helpful.
I bet.
I mean, I have some clients who are severely traumatized,
Mhm.
and when they begin to get triggered, they can just do some yoga or some
Mhm.
meditative,
Mhm.
deep relaxation, deep breathing. A lot of that helps. And it's not a cure all.
Right.
There's a cognitive piece that goes with it, and there's, I think, relational piece.
Mhm.
I don't think anyone heals very well in the vacuum.
Right.
Some people are introverted and don't need or want a lot of
Mhm.
interaction socially,
Yeah.
but they still need in order to heal. I mean, that's why you and I have a job
Mhm.
as psychologists, is
Right.
people need it's psychology is as much an art as it is a science.
That's really true.
I mean, you can go on Google and find a lot of answers.
Yeah.
Someone can say, well, I'm depressed. What should I do?
Yeah.
And get a list of 20 things. But
Mhm.
without a human to interact around those
Oh,
things
I
with,
agree. I
it's
agree.
very difficult
I
to
really
heal.
agree. It's interesting. I'm sure that you've heard this like a million times where people say, "Oh, I have talked to my family and say, oh, well, you need to pull yourself up by your bootstraps."
Exactly.
And I've said on many occasions, "Hey, if it was that easy,
Right.
don't you think you would have already done it?"
Yeah.
Okay,
Those
it's
kind of
not that easy. I
those
mean,
kind of comments are not helpful.
no, it's not. In
It just
fact,
shames the person
it
for
it
having
really
symptoms.
that's exactly what I was gonna say. It seems
Mhm.
so judgmental,
Yeah.
and isn't it interesting that that judgmentalism does not exist for medical
Mm.
disorders in most cases, unless
Right.
people brought it on themselves, maybe drinking too much and,
Mhm.
liver cancer or something, but
Right.
in most cases, that judgment's not there, but it is with mental health,
Mhm.
and that's just really weird that,
Right.
"Oh, it's almost kinda like it's your fault because you're not strong enough." No, it's not that
Yeah.
easy, folks.
Well, and I don't like everything about the medical model because I think it kind of limits the way
It
we think
does.
about
It
mental
does.
health.
It does.
But in many cases, our mental health is a physical as well as mental thing.
Oh, absolutely.
Schizophrenia, bipolar disorder, ADHD, a
Mhm.
lot of those have underlying physical
Absolutely.
causes. And
Absolutely.
even if it's psychologically caused, you can't separate the mind and the body.
No, you can't. You
If the
can't.
mind is disturbed, it's going to have, I mean, there are people who have hysterical blindness.
I mean, and think about it. How many times have you had, and I've told my patients this many times in the past, there are some disorders that there is more of that than others. I think
Mhm.
schizophrenia, bipolar disorder, ADHD,
Right.
there's something physical going on there. Okay,
Mhm.
there really is.
Right.
Because I think we've both seen probably many times, especially with bipolars and schizophrenics, that until you get them on some medicine,
Right.
I mean, you could do all the psychotherapy in the world, and you might help them to manage it a little bit,
Right.
but you have to get that biochemistry right. You
Mhm.
really do, or you have to get some help there before you
Yeah.
could really do the psychotherapy. So
Sure.
there's always, I mean, we as clinicians, we always focus on the psychotherapy part and hopefully lifestyle interventions and things like that. But the bottom line is there is the chemical part. And I don't ever, in any way, because of what I do, deny the importance of that. I
Yeah.
recognize that medicines are a tool also.
Yeah. And I believe in a holistic
I do too.
approach, sometimes even natural substances. But,
Sure.
I know patients who had bipolar or schizophrenia who were given the right medication.
Mhm.
Sometimes it takes 4 or 5 tries
Oh, yeah,
to
sure.
figure out what that is.
Absolutely.
But once they find the right medication, they're a different person.
Absolutely.
Their symptoms, they don't necessarily all
Absolutely.
completely go away, but they're moderated
Mhm.
and they're much more functional.
Oh, absolutely. Well, I appreciate this discussion. Any final thoughts that you might have?
Well, I just think in terms of treatment and also in maintaining your own mental health, don't be afraid to seek professional help. I
Absolutely.
don't know how many people have walked into my office that have known for years that they need some help,
Mhm.
but will not get it. And I think
Mhm.
men are particularly bad about that.
Mhm.
They have this Lone Ranger
Oh,
mentality.
yeah. Oh,
I
yeah.
should
Oh,
be
yeah,
strong and take care of this. Well,
yeah.
that's baloney.
Yeah.
We all have weaknesses. I have couples who come in. Actually, the studies show that the average couple knows they have a marital issue
Mhm.
for 7 years
Oh, my gosh.
before they actually seek help.
Yeah.
That's on an average.
Yeah.
So being aware that professional help is out there, and it may not be the first counselor you go to.
Mhm.
You may have to go to 2 or 3
Right.
to find the right fit.
Somebody that fits.
Right. But the other thing is that we need to build a sense of safety. We need to be cognizant of our awareness, our environment. We can't control a lot of things, but some things we can.
Yes.
When we're fearful, sometimes there are concrete things we can do to minimize risks. And we should do those things and then let it go and turn it
Yes.
over to God, or realize
Mhm.
your limits, what you
Right,
can control.
Right.
And then probably the biggest one in my mind is don't isolate.
Mhm.
No man is an island, as I said before, and we cannot navigate this life well
Mhm.
without support.
Yeah.
I mean, I don't know about you, but without my wife and my kids and my friends, my life would be a whole lot worse. It would be lonely. It would be hard. And if I don't have someone to turn to, even if it's only for a few minutes,
Yes.
if I don't have a resource out there, it's tough.
It's all about relationship, Bill. When
Mhm.
it gets down to it, it's all about relationship. All
I
these
agree.
houses and cars and college diplomas and
Right.
stock portfolios and all that.
That doesn't
And the
bring
final
happiness.
analysis.
Right.
That's not where it's at. It's all about relationship, and it's about the way we live our life and
Mhm.
the way that we're there to help other people.
Yeah, and self-care is
Mhm.
important. When my wife and I went through that traumatic abduction, I didn't sleep well.
Oh, I
And
bet.
that contributed to
My
my
gosh.
poor mental health.
Oh, yeah.
And I'd started taking some sleeping pills, which helped. But regular sleep, having good sleep hygiene,
Mhm.
being aware, some people overuse drug and alcohol.
Mhm.
And I think just to know that our bodies, our minds, we need to care for ourselves. Again, many people have this thing of, I need to care for my dog and my cat and my family. Well, what about yourself?
Oh, absolutely.
We have to put ourselves. What I
Absolutely.
try to tell people is that, unless you take good care of yourself, you're not going to have the resources to care for others the way
Yeah.
you want to.
Yeah, it's really true. The analogy I give my patients and have had over the years is whenever we fly, it's interesting that the stewardess, I guess they still do this. It's been a little while since I've been on a plane, but they would get up and they would do their little demonstration. They'd
Right.
say, okay, when the air pressure drops and the mask will drop down, and if you have a child, always put it on yourself
First.
before you put it on the child. And I've asked my patients many times, I said, why do they say that?
Mhm.
And a lot of times people really don't get it. I said, because if you don't take care of yourself, how can you take care of the child?
Exactly.
And I just think that that's a good analogy for
Sure.
understanding in many ways how we have to take care of ourselves. There's nothing selfish about taking care of ourselves so we can take care of other people.
Yeah. When people think that it's selfish, I try to help them see there's a difference between self-care
Right,
and being
right.
selfish.
Very good.
And if we
Very good.
if we put it in terms of selfishness,
Mhm.
then we don't do it.
Right.
But we all need to be a little selfish, is what I try to say to
Well,
people.
yes.
And we all
yes,
are.
in that way.
One way or another,
Mhm.
we have to care for ourselves.
We do.
So there's nothing wrong with that. As a matter of fact, it's essential.
Yeah. Well, I appreciate you sharing your story, and I know that was
Sure.
a terrible time in your life. I could not imagine going through something like that, and the way it
Right.
affected you, the way it affected your wife, the way I'm sure it affected the two of you together.
Mhm.
And so thank
Well,
you for sharing your
sure.
story.
I might just say that none of us knows what's around the next corner.
Right. Absolutely.
And so that thing about control, we have to accept that there's only some things we can control.
Mhm.
But I think what helps is just having a quiet self-confidence
Yeah.
that, for me, my faith is a big part of it, but
Mhm.
knowing that whatever happens to me,
Yeah.
I'm going to be okay.
I will be okay.
And when you have
will
that
be okay.
belief, it's amazing what you can
And you know
get
what?
through.
That right there in a future episode is one of the things I want to talk about.
Mhm.
How we can know that we will be okay.
Mhm.
Okay. Because there's a way to know that.
Oh, yeah.
And I hope that people will come back and
Mhm.
tune into us at another point in time. And I'm going to keep it a mystery at this
Okay.
point in time.
Me too. I have a
Because
guess,
it's a mystery.
but I won't say what it is.
And so, anyway, thank you, Bill.
Thank you, Paul.
really enjoyed this.
Likewise.
It's the first time I've ever done this, first time you've ever done this. So I
Mhm.
know, probably started out a little bit not really knowing what to expect, but as we've gone
Yeah.
along, it's felt a lot better, and I've
Yeah.
enjoyed it. And thank you very much.
Likewise. And let's just let you know you did okay.
Okay.
You
Well,
can have that
you
confidence.
you you did okay too. Somehow we did okay.
I think so. We'll have to ask the audience,
Yeah,
but I
yeah,
think
we
we did
will
all right.
if we have one.
My wife will critique it for me.
Yeah, if we have an audience, at least we're gonna have 3 or 4 because
I
I
hope
can get
so.
some family members to watch it, I'm
There you
sure.
go. I say this real quick. I did some stand-up. I had open
Yeah.
heart surgery recently,
Yeah.
and I did some stand-up afterwards, poking fun at what I did, and had invited people
Yeah.
and said, "You need to heckle me." And it's interesting, just the interaction. I actually felt more comfortable having
Yeah.
people there who occasionally said, "What are you talking about?" or something, because it was that interaction that was so
Right,
important.
right.
But yeah,
Right.
but it's amazing if you know what you're doing, if you have that confidence, if you
Mhm.
trust God, if you trust yourself and those
Mhm.
around you, we can get through an awful
Oh,
lot.
yeah, everything,
Trauma and
everything, absolutely. Well, thank you, Bill.
Thank you.
Yeah,
Appreciate it, Paul.
yeah, you too.